Condyloma acuminata, or genital warts, is a sexually transmitted infection that causes small, skin-colored or pink growths on the labia, vagina, anal region, penis, oral region. Warts may affect both genders. Genital warts are caused by the HPV or human papillomavirus. It is a common sexual transmitted infection. There are over 100 types of HPV and cause different types of problems. HPV 6 and 11 are the major cause of warts. HPV types 16 and 18 are the major causes of cervical or HPV-related cancers, including cervical, penile, oral. The wart-producing strains of HPV do not typically cause cancer. HPV is transmitted by direct skin-to-skin contact, including sexual intercourse, oral sex, anal sex, and any other type of contact involving the genital area. Most people affected do not have visible warts, but they can still transmit the virus. Treating the warts may not decrease the chance of spreading the virus. People who are sexually active should be regarded as potential sources of HPV, not just those with visible warts. Warts may appear weeks or years after being exposed to the HPV virus. It is not usually possible to know when the person got infected. Warts are skin-colored or pink, may be smooth or flat, or raised and rough, usually located around sexual organs. Most people have no symptoms. Some people may develop itchiness, burning, or tenderness in the area affected. It is diagnosed by an exam. A biopsy may be needed if the provider is not certain. There are many ways to treat genital warts. Some of them involve a medication, some of them may involve a procedure. Even with treatment, warts may come back within a few weeks or a few months. This is because treating warts does not necessarily treat the HPV virus, which is what is causing the warts. Currently, there is no cure for HPV. Some people will clear the virus and the warts on their own with the help of their own immune system within 2 years. The best treatment depends on how many warts the person has, the location, what other health conditions the person has, and the healthcare provider recommendations. Medical treatments include creams or liquids that you or the doctor may provide or may apply to the wart. These may need to be used several times per week for a few weeks or months until the wart goes away. Some examples include podophyllin, Podophylox, trichloroacetic acid, imiquimod, interferon. Surgical treatments include treatments that remove the wart, like an excision. There are also treatments that destroy the warts, like freezing or burning it. Some of these treatments may need to be combined. Usually surgery is required when the warts do not respond to medical treatment or medicines, when the warts are large, certain places where it is not easy to get medication, and areas where there could be precancer cells, in addition to the warts. Some examples include cryotherapy, electrocautery, excision, and laser. Getting rid of the warts does not necessarily mean that the person is getting rid of the HPV. If warts come back, they usually do within 3 to 6 months. It is more common in people with a weakened immune system, such as diabetes, HIV, certain medications, cancer, and others. Genital warts and HPV can be prevented with the HPV or Gardasil vaccine. Gardasil helps to prevent infection from 9 types of HPV, especially 6, 11, 16, and 18. The vaccine will help prevent most cases of genital warts caused by HPV 6 and 11 and cervical cancer caused by HPV 16, 18, and other 5 types of HPV. The vaccine is not treatment. Avoiding people who have genital warts or HPV can reduce the risk of becoming infected with HPV. Most people with HPV do not know they have it and do not have visible warts. Condoms are helpful, but they do not provide complete protection against HPV. Areas not covered by a condom can spread HPV from one person to another. It is important to have an honest talk. HPV is very common. Most people have no symptoms. It's important to discuss options and treatment and prevention with your provider. I hope this topic was helpful. Please follow my social media. Thank you.